There are so many new vendors out there around patient-facing technologies. There are so many opportunities about how we can actually engage the patient and have the patient at the center. The hard part for most healthcare organizations is to move from a physician-centric world to a patient-centric world. And so as we talk to healthcare providers, they have a strategy to go and figure out how to work with the patients. Very few of them actually have a tangible, credible strategy about what unique thing they're going to do outside of, we're going to start with our portal, we're going to see how many people we can get on our portal, and then we're going to figure out something really creative and unique that we're going to do after that. Of all the things we're working on, whether that could be aggregating data or getting data into the clinician's workflow so the physician has better tools to make decisions, or having analysis for true cost of care and what's happening on the cost side, we're further along on all of those tools than we are on the patient side. And there's probably a lot of good reasons for that, but we just haven't figured out how to engage the patient. And again, I think that comes from most health systems were not built around the patient, as odd as that is to say. They were built around a lot of other things that they could deploy and around the physicians. And now, how do you shift that thinking to what is the patient really going to need? And the other half of that is patients have not historically been that engaged, or don't know how to be engaged. They may want to be engaged, they may want to know where the best price is for something, but as you go to implement price transparency, for example, as a health system, there are more hands pulling down to say, let's not do that, than there are patient hands raising to say, let's go tackle some transparency.